Myofascial lines consist of 600 muscles which are connected within each other. These are also referred to as your anterior and posterior slings, which wrap around the entire body and the contralateral upper and lower extremities. All the connective tissues are known to flow into one another, muscle to tendon, to ligament to bone, and sometimes muscle into muscles. Everything blends. So why is this so important? If all connective tissues can be traced back to a single precursor cell, a fibroblast, then tissue and cellular responses to external stimuli will be similar in each tissue, also known as progressive adaptation to some extent. Incremental loads imparted on any human tissue result in adaptation of tissue such that the load absorption capacity improves. These are also known as specific adaptations of implied demands. Adaptation can include the addition of new tissue and/or tissue of better and stronger quality. Tissues that are able to bend more are not more resilient to injury. Some research will suggest stretching may cause more harm than good. Historically, it was believed to decrease viscoelasticity. Muscles are both elastic and viscous. Over time, the viscous component leads to more motion than returns to a resting length. The elastic component returns to muscle eventually back to its original length. This is very short-lived. Stretching for long periods of time changes range of motion, but the tissues have been shown to remain the same. In theory, the more force the tissue can absorb, the less likely it is to be injured. Stretching does the opposite. How does flexibility increase over time then? Stretch tolerance occurs through the central nervous system. It must alter its governor mechanics, the stretch reflex. Here's an example. The central nervous system likes to maintain the norm, prolonged shortened positions or postures, which cause the stretch reflex sensitivity to increase. An example would be the upper cross syndrome. This increases the threshold of sensitivity. Also, if your central nervous system determines you are not strong enough to achieve that range of motion, it will not allow you to go into that range of motion. If flexibility can be achieved safely, then the central nervous system will allow you to get there. There are always reserved potential end ranges of range of motion that have the potential to be tapped into. Hip flexion, for example. Remember, 90 plus 90 does not always equal 180. Hip flexion on the right and left simultaneously into a full split may not happen, although there is 90 degrees on the right and 90 on the left. What is preventing us from doing it at the same time? It's the stretch reflex. Stretching also has an analgesic effect. Along with inducing hypertrophy, it also has the ability to improve maximum voluntary isometric contractions. This can cause alterations in the central nervous system. With the stretch physiology, ideology, or outlook, pre-exercise stretching will not reduce the likelihood of hurting yourself. Doesn't mean you shouldn't stretch. The research suggests we should all stretch, but why won't it prevent injury? As an example, if you don't have the range of motion to squat, some might do foam rolling, some type of static stretching on their hamstrings to improve their range of motion, then attempt to do the squat again. This could be very dangerous and detrimental to your joint health, also your muscle function and your muscle health, after foam rolling into a self-sense of security. Immediate effects change flexibility short term, as they're, once again stated, short-lived. How do we make them more permanent? We must convince the nervous system to tap into that range of motion through the stretch reflex. Yoga will temporarily take your body into those ranges. We must learn how to do real contractions in that range of motion that was newly acquired to maintain that range of motion and learn how to use it with viable contractions. We are all flexible in terms of the mechanical makeup of our tissues. The nervous system, however, needs to be convinced. This will teach us first to expand the ranges of motion in order to continue with controlling the ranges later with different techniques. The body moves best in mid-range. Unfortunately, this is a default in the nervous system. Due to the sarcomere makeup, there is not enough in the passive insufficiencies and too much overlap in the active insufficiencies. The agonist will facilitate newly acquired ranges of motion, expanding the tissue and capturing longer angles of tissue loading. The antagonist will strengthen in shorter angles, This will teach the nervous system how to gain control in shorter lengths. The main goals are to teach the nervous system how to control progressively larger ranges of motion and prepare the body's tissues for function in the newly acquired ranges. After doing so, the individual should be able to activate more motor units and increase neural drive in that particular motion, loading it with appropriate amount of afferent inputs. These isometrics in a stretched position convinces the central nervous system that you are or that you have control of a particular range of motion. Thus, a conservative allowance of 10 to 15 degrees of motion is granted by altering the stretch reflex sensitivity. This is a safe and efficient way for activating motor units, influencing the SAID principle. These contract-relax techniques can improve the entire range of motion and at the same time improve strength and flexibility. Another benefit of these isometrics during the contract-relax method is in its ability to increase all fibroblasts for all tissues. It assists with the development of tissue adaptation. Also, it has balanced load across the entire muscle tissue and does not increase inflammatory mediators, as opposed to concentric and eccentric contractions. This helps prepare the body for further exercises, making it more resilient, all the way into the cellular matrix on a histology level. It decreases pain, helps attenuate muscle damage, and explores new range of motion within the strength curve. Important to note, these should be the first choices of exercises before more strenuous contractions. For rehabilitation purposes after an injury, use the language of force so we can arrange the new fibroblast cells to heal the way you will want them to, how we want to guide the tissue along. Looking to pump bad fluid out and bring healthy fluid in. Then we will start with isometric loading. Passive range of motion is the most important prerequisite to mobility. Flexibility is the rate limiting factor of range of motion. It's useless if all we did was passive range of motion and passive stretching. It's important to do active range of motion within the range that you have. The more load you give the body, as long as it can tolerate that load in accordance with tissue healing time, the body will adapt and lay down new healthy tissue. We must put progressive loads into the direction of that injury and on the tissue that was altered. As a PT, we can always start with manual agonist and antagonist contract-relax techniques, but we must get the threshold back to where the injury was sustained. Higher levels of stress placed on the tissue and then greater on top of what was present before to prevent injury from occurring again. We can use this for a variety of situations, such as tendinosis, tendinopathy, ligament tears, tendon issues, muscle tears, motor control issues, load distribution problems, movement correction. They can also help with collagen deposition. So take, for example, a tendinopathy. Mid-range isometrics have most force at the mid-belly. Stretching muscles will place more stress in the distal regions of the muscle. Find ranges that will give slight reproduction of symptoms before applying isometric loading. Start with basic interventions, then start to get into more complicated aspects with your treatments. We're talking about isometric loading right now, avoiding shear forces, and eventually into eccentric training, which we'll talk about later. It's important to note, if the load is greater than the capacity, we will most likely have injury. If the load is less than the capacity, it's better known as rehabilitation. And also, if the capacity is greater than the load, this is also known as preventative nature or prophylactic treatment. We must respect tissue healing times and implement progressive loads with its healing time capabilities. A tissue load capacity that is stronger than the loads being placed on it will be considered injury prevention. The chances of it being hurt will be reduced significantly. So, by increasing the bell curve range, or the graph, we will have more control throughout the range of motion. New tissue adaptation. We want to make sure the tissue is resilient in the newly acquired range, allowing you to move into 15-degree intervals. The nervous system starts to believe the body can actually move well in that newly acquired range. It also allows to effectively access all of your motor units with an overcoming exercise. Maximal neural drive. If you want more output from the muscles, do isometrics to definitely get what you want. How do we handle these longer ranges and shorter ranges of motions? We are looking for a gradual increase in the irradiation while doing these motion patterns at different levels. At level 1, mainly used for rehab purposes, this provides low-level isometric input to reinforce tissue directionality, 10 to 30% of your MVC. This will move 5 degrees out of the painful range of motion and then start isometric contractions. For level 2, we'll utilize contract-relax stretching and agonist technique for only treatment and rehab. For level 3, this will be used for rapidly expanding usable ranges of motion and using neurological adaptations 70% to 100% of your MVC. Also think about endurance of the tissue, lighter holds with longer durations. Really no specific sets, reps, or durations. It really all depends on the patient and their needs. Important to remember, in order working its way out from the deepest layer to the most superficial layers, the capsule receives the information first. One joint is simple, multi-joints are more complex. Then into the soft tissue structures as the muscle and tendons, etc. The science behind agonist and antagonist stretching causes more architectural changes, while antagonist stretching causes more neurological changes. The duration is the same, but there is a slow ramp-up time for the agonist, while the antagonist is initiated as a hard and fast contraction. The slow ramp-up is because we want to progressively load the myofascial lines and slings with one another at length to preferentially load cells with directionality. Remember, all the soft tissue has some type of connection. The antagonist is done hard and fast because we're trying to maximize neurological drive on the short side.